हमारा जो फैक्ट्री अंडमान ऑर्गेनिक प्रोडक्ट जो कालीघाट में है, इसमें हम लोग कोकोनट ऑयल बनाते हैं, वर्जिन कोकोनट ऑयल और सोप, कॉस्मेटिक प्रोडक्ट्स भी बनाते हैं। इसमें हम लोग जो फ्रेश कोकोनट है उसको तोड़ के उसको हम लोग ड्राई करते हैं। जैसे ड्राई करने के बाद उसको छोटे पीसेस में काट के फिर से हम ड्राई करते हैं। उसके बाद में हम इसको कोल्ड प्रेस चक्की उसमें हम उसको पीस के फ्रेश तेल निकालते हैं। और जो सोप बनाने का जो प्रोसेस है, कोकोनट ऑयल से हमारा सोप बनता है। जो यहाँ का लोकल इंग्रेडिएंट्स है उसमें मिला के वहाँ उसमें हम सोप बनाते हैं। जैसा सिनेमन है, नटमेग है, पपाया, यहाँ का टर्मरिक, ऐसा हमारे पास में 10-12 वैरायटी सोप्स हैं हमारे पास, जो हैंडमेड सोप्स हैं। और हमारे कालीघाट की जो फैक्ट्री है वहाँ पे डायरेक्ट कस्टमर्स भी आके लेके जाते हैं। आप भी हमारे जो प्रोडक्ट्स है ट्राई करके देखिए, आपको भी पसंद आएगा।
हमारे आइलैंड्स के ताज़ा खबरों और इम्पोर्टेंट अपडेट से जुड़े रहे भरोसेमंद और पक्की जानकारी सीधे अपने फ़ोन पर पाने के लिए न्यूज़ आप तक व्हाट्सएप चैनल को अभी फॉलो करें।
सभी को नमस्कार। इस वक्त हम लोग अपोलो हॉस्पिटल श्री विजयपुरम में हम लोग हैं और हम लोग साथ में श्रीनिवासन परमशिवम सर, हम लोग डॉक्टर सर हम लोग साथ में। और मेनली इंपॉर्टेंट बोलना चाहेंगे कि न्यूरो सर्जन सर है और अंडमान निकोबार में सभी को जानते हैं कि न्यूरो सर्जन का बहुत ही ज़्यादा इंपॉर्टेंट डिमांड है अंडमान में, क्योंकि गवर्नमेंट में तो नहीं है बट प्राइवेट में अपोलो हॉस्पिटल न्यूरो सर्जन फैसिलिटी दे रहे हैं पब्लिक को। तो सर से जानना चाहेंगे किस तरह का अपोलो हॉस्पिटल से श्री विजयपुरम न्यूरो सर्जन का इसमें सर्विस दे रहे हैं। सर से बात करेंगे।
Hello everyone, I am Dr. Srinivasan Paramasivam, neurosurgeon and neuroendovascular surgeon from Apollo Hospitals, Chennai. I will be visiting Andaman Nicobar Islands once every 2 to 3 months, and I'll be available on Saturdays once every 2 to 3 months at Apollo Clinic at Port Blair. I'm a neurosurgeon and neuroendovascular surgeon. Neurosurgery means we operate on the brain and spine. Any patient with the disorders of the brain and spine, there are certain diseases which can be treated only by surgery. For example, if somebody has acute severe head injury and bleeding within the brain, or somebody has a tumor which grows inside or outside the brain, which compresses on the brain, or in the spinal cord due to degeneration, for example, in the neck, which is a mobile segment of the spine, if they have degeneration, or in the spine, lumbar spine at the back, if they have degeneration, we operate on the spine to cure them of the problems and the pain that they have. This is what is neurosurgery is all about, and this subspecialty has evolved significantly. We also treat significant number of stroke and patients with disorders like brain aneurysm, brain arteriovenous malformation by both endovascular, that is going inside the blood vessel and operating, as well as by microneurosurgery, operating with the microscope to relieve the problems in brain and spine.
So what are the most common brain and spine related condition you have seen among the patient from Andaman Nicobar Island?
Yeah, brain and spine related problems are not uncommon problems. I will just talk to you about the common symptoms. For example, somebody presenting with a headache. Everybody would have experienced headache at some point in their lifetime. And the headache is primarily, we divide the headache into primary headache, which is usually due to migraine or tension headache without any causes, or headache due to secondary causes. The secondary causes may be headache can happen due to the structures in the face and the ear, like eye infection or ear infection or any pathology in the ear. Toothache can also present with the headache. These are all secondary headache, but sometimes, very rarely, you can get headache due to intracranial problem. That is, some brain tumor growing inside the brain which progressively enlarges to cause continuous severe headache associated with some features like vomiting, giddiness, or weakness of the hands or legs, other associated symptoms. Those need to be taken very, very seriously. And if you develop a headache which is not your usual headache, if you develop a headache all of a sudden, very severe headache or continuous headache or associated with vomiting, then those symptoms you need to pay attention and you need to meet the specialists like us and get proper treatment. The other common symptoms people come to us are symptoms like neck pain. Neck pain is a very, very common symptom, and the common reason for the neck pain is bad posturing. When they are working in the computer, they have to sit straight with the neck erect, and they have to sit with the computer looking up rather than couching down and then looking at the phone all the time. You tend to develop a lot of neck pain. So you need to have proper posturing as well as strengthening exercise. Most of us do exercise for the hands and legs, but we forget the core muscles, that is the trunk muscles and neck. You need to do specific exercises, maintain posture to avoid. If you ignore that over a period of time, the spine will get degenerated. That may lead on to more aggressive treatment like surgical stabilization. Likewise, the lumbar back pain is a very, very common problem. It is because of the obesity, truncal obesity, and the muscle weakness of the back. You need to maintain the posture erect, and you need to do back strengthening exercise to avoid early degeneration. With that, you can avoid major surgeries in future.
Sir, neurological disorders such as stroke and spinal problem increasing among the younger people.
Stroke in general, it's a broad spectrum of disease. Stroke happens due to two reasons. One is lack of blood supply to the brain or bleeding within the brain. We are seeing it relatively more and more commonly in younger people, but stroke can happen at any age. The reason for happening in younger individuals is because of the bad lifestyle. It's because of poor dietary intake with a lot of fat and oil intake, sedentary lifestyle, they don't work enough, increased obesity among young people, and lack of physical activity or physical exercise all leads to stroke in younger people. Unfortunately, this lifestyle has caught up so much that we see more strokes in people in the ages of late 20s and 30s. And this is devastating because if they are affected with stroke, it may lead on to hand leg weakness that may be permanent, and they become dependent on others for the rest of their life. So, lifestyle modification is extremely, extremely important.
So when should a patient consult a neurosurgeon instead of a general physician?
See, in general, most of the problems like general body aches, mild form of neck pain, back pain, headaches can be managed by general physicians. But if your symptoms are not getting cured with general physicians management, which are the common problems, then you need to seek the advice of either senior neurologist or neurosurgeons and get that sorted out. You may need advanced imaging like CT scan or MRI scan to look at the structural abnormalities in brain and spine before treatment by a neurosurgeon.
So what advice would you like to give the people of Andaman Nicobar Island for maintaining good brain and spine health?
In general, the mental health is very, very important. Mental health, I mean having health without anxiety or depression, is extremely important. For that, the most important thing is you need to do regular physical activity, and you should not get into quarrels. Keep a very steady mind with regards to maintaining harmony among your family, friends, and relatives. And unnecessary avoidance of these quarrel will maintain the mental health. Apart from that, maintaining the exercises, physical activity for the core strengthening, back, neck muscles will maintain the health of the spine. So you need to keep this in mind and lead a healthy life. Thank you.